Tiny brain capillaries rely on nitric oxide to relax. Nitric oxide production falls after age 60. Capillaries narrow and oxygen delivery to brain tissue slows. Beetroot supplies dietary nitrate that feeds the nitric oxide pathway. Oral bacteria and blood enzymes convert nitrate into nitric oxide. In studies, that conversion has been associated with improved microvascular dilation and oxygen transport. Watch to learn the mechanisms. See the current evidence and practical considerations. This is science and data, not medical advice. Hook. Brain fog may be oxygen delivery, not memory loss. Brain fog may reflect impaired oxygen delivery rather than primary memory loss. Capillaries and small arterioles supply oxygen to neurons through tightly regulated flow. When that system falters, neuronal activity can outpace oxygen supply and processing speed slows. Endothelial cells and paravascular signaling control microvascular tone. Nitric oxide is a key messenger in that mechanism. Aging reduces endothelial nitric oxide signaling through oxidative stress and reduced enzyme activity, which causes smaller vessel dilations and fewer active capillaries during cognitive demand. And the effect is less efficient oxygen extraction in brain tissue. Dietary nitrate from beetroot follows a distinct biochemical route. Oral bacteria reduce nitrate to nitrite, and nitrite converts to nitric oxide, especially under low oxygen conditions. When endogenous NO production is reduced with age, this enterosalivary pathway can augment NO availability, which in turn causes local microvascular dilation and enhanced perfusion in tissues that need oxygen. Beetroot and other nitrate-rich foods provide a practical case study for this pathway. Consuming beetroot increases circulating nitrite levels and can raise NO bioavailability, depending on how the food is prepared and eaten. The cause-and-effect sequence is clear. Nitrate intake, nitrite formation via oral microbes, increased NO under hypoxic conditions, improved microvascular flow, and oxygen delivery in at least some vascular beds. Older adults face additional modifiers of that pathway. Changes in the oral microbiome, frequent use of antiseptic mouthwash, and antibiotic courses reduce conversion of nitrate to nitrite. The mechanism is disruption of the oral bacteria that act as a first step. The cause is altered microbiota or chemical suppression. The effect is attenuated benefit from dietary nitrate, and possibly continued microcirculatory insufficiency in brain regions active during thinking tasks. Practical factors matter for translating mechanism to potential effect. Whole beets, beetroot juice, and leafy greens differ in nitrate content and in how they are absorbed. Food processing, concurrent meals, and hydration alter bioavailability. These causes change how much nitrite is formed and how much nitric oxide is produced at the microvascular level, and the resulting effect is variability in any improvement in regional oxygenation. There are limits and caveats to consider. Oral hygiene practices and certain medications can blunt the nitrite, NO pathway, which reduces the mechanism's downstream effect on microcirculation. Combining dietary nitrate with lifestyle measures that support endothelial health, like regular activity and blood pressure control, targets both causes of reduction and increases the chance of preserving tissue oxygen delivery, potentially reducing episodes of cognitive slowing without promising cures. Define microcirculation and capillary density changes with age. Microcirculation refers to the network of small blood vessels that includes arterioles, capillaries, and venules. Its primary mechanism is to deliver oxygen and nutrients and to remove metabolic waste at the tissue level. This function depends on thin endothelial walls, close proximity of capillaries to cells, and dynamic control of local blood flow. When those structural and regulatory elements change, exchange becomes less efficient and tissues receive less oxygen for the same perfusion pressure. Capillary density is the number of capillaries per unit tissue volume or muscle fiber, and it sets the available surface area for gas and solute exchange. Age-related mechanisms such as endothelial cell senescence, reduced angiogenic signaling, and chronic low-grade inflammation lead to capillary rarefaction. The cause includes lower production of vasoprotective mediators like nitric oxide, altered growth factor responses, and parasite dysfunction. The effect is fewer perfused capillaries, increased mean diffusion distance for oxygen, and reduced overall tissue oxygen extraction. In the brain, microcirculatory architecture relies on a dense capillary bed fed by PL and penetrating arterioles and regulated by neurovascular coupling. Mechanistically, active dilation of small arterioles and redistribution of flow maintain oxygen delivery to active neurons. With aging, causes such as arterial stiffening, impaired endothelial signaling, and basement membrane thickening blunt these vasodilatory responses. The consequence is a reduced ability to match blood supply to local metabolic demand, producing regions with lower oxygen tension and greater susceptibility to metabolic stress. Functional and imaging examples illustrate these links. Mechanisms like capillary pruning and loss of perfused microvessels manifest as lower capillary density in aged tissue samples and as reduced perfusion reserve on functional scans. Causes such as microvascular rarefaction and blood-brain barrier changes are associated with markers of small vessel disease on MRI, including white matter changes. The net effect is a measurable decline in microvascular oxygen delivery and a diminished capacity for rapid increases in supply during neural activity. Explain nitric oxide pathway and vascular dilation. Endothelial cells synthesize nitric oxide when the enzyme endothelial nitric oxide synthase, ENOS, converts the amino acid L-arginine to NO and L-citrulline, a reaction that requires oxygen and cofactors such as tetrahydrobiopterin and NADPH. This enzymatic mechanism is activated by rises in intracellular calcium that allow calmodulin to bind ENOS and by kinase-mediated phosphorylation events such as ACT signaling downstream of receptor or shear stress stimulation. The result is rapid NO release into the vessel wall, where it diffuses to nearby smooth muscle and begins the vasodilatory cascade. In vascular smooth muscle, NO binds the heme moiety of soluble guanylate cyclase, SGC, and stimulates conversion of GTP to cyclic GMP, cGMP, a second messenger that activates protein kinase G, PKG. This biochemical mechanism is triggered by the NO that diffuses from endothelial cells or is produced locally from nitrite reduction under low oxygen conditions, so the amount of cGMP produced reflects upstream NO availability. The downstream effect is reduced intracellular calcium and increased myosin light chain phosphatase activity, which together relax smooth muscle filaments and widen the vessel lumen to lower vascular resistance. An alternative biochemical pathway supplies NO from dietary nitrate via a nitrate-nitrite-nitric oxide sequence that does not rely on ENOS. Oral bacteria reduce nitrate to nitrite, and then enzymatic or non-enzymatic reduction, facilitated by low oxygen tension and acidic microenvironments, produces NO. This pathway becomes more prominent when oxygen is low or when ENOS activity is limited because nitrite reduction is favored under hypoxic conditions and by reductases such as xanthine oxidoreductase or deoxyhemoglobin. The physiological consequence is targeted NO generation in hypoxic tissues, promoting local vasodilation and matching blood flow to areas with greater oxygen demand. NO bioavailability depends on production, scavenging, and enzymatic coupling, and oxidative stress alters these balances by reacting with NO to form peroxynitrite or by oxidizing cofactors like tetrahydrobiopterin, which causes ENOS uncoupling and superoxide production instead of NO. These molecular mechanisms are provoked by factors that elevate reactive oxygen species or reduce cofactor regeneration, such as inflammation or metabolic imbalance. The net effect is diminished vasodilatory signaling, reduced microvascular perfusion, and impaired tissue oxygen delivery when NO pathways are disrupted. Connect reduced blood flow to cold extremities and cognitive slowdown. Aging alters the fine networks that deliver blood to tissue. Endothelial cells lose some ability to produce nitric oxide, the chemical signal that tells tiny arterioles and capillaries to relax. Reduced nitric oxide availability causes diminished vasodilation in the skin and brain microvasculature. The effect is slower flow through capillary beds, which often shows up as cold fingers and toes in people over 60. Capillary rarefaction is part of the mechanism. The small vessels become fewer and less responsive. That change lowers the surface area for oxygen exchange in both peripheral tissues and the cortex. Consequently, skin temperature drops in extremities because warm blood bypasses distal capillaries and cerebral oxygen delivery becomes less responsive to demand, contributing to slower cognitive processing speed. Neurovascular coupling depends on rapid dilation of local microvessels when neurons activate. With impaired microcirculatory dilation, the link between neuronal activity and increased local blood flow weakens. The cause includes stiffened arterioles and reduced endothelial signaling. The effect is a blunted rise in tissue oxygenation during mental tasks, which correlates with slower reaction times and reduced processing efficiency on attention and executive function tests. Beetroot provides a practical case study for the nitric oxide pathway. Dietary nitrate from beetroot is reduced by oral bacteria to nitrite and then to nitric oxide under low oxygen or acidic conditions. This alternative NO source bypasses part of the age-related endothelial dysfunction. As a result, peripheral vasodilation can increase, sometimes raising skin temperature in distal limbs and improving measurable cutaneous blood flow. In the brain, increased NO availability can augment microvascular dilation and improve cerebral oxygenation responses during tasks, but responses vary by individual. Oral environment and medications influence the mechanism. Using strong antiseptic mouthwash suppresses the oral bacteria that convert nitrate to nitrite. Certain drugs affect NO signaling as well. These causes explain why two older adults with similar diets can show different peripheral warmth and cognitive responses after consuming beetroot products. The effect is inconsistent real-world benefit, not a guaranteed remedy. Objective measures illustrate the connection between reduced peripheral flow and cognitive slowdown. Skin thermography and laser Doppler imaging detect colder extremities and lower skin perfusion. Near-infrared spectroscopy and transcranial Doppler measure lower task-related increases in cerebral oxygenation or blood velocity. Mechanically, lower capillary perfusion limits oxygen delivery, causing neurons to operate nearer their metabolic limits and produce slower, less efficient signaling. The observable consequence is measurable slowing on timed cognitive tasks and reports of increased mental effort for routine activities. Practical examples highlight pathways without promising cures. A person with persistent cold hands often shows reduced fingertip capillary density and slower finger perfusion recovery after mild occlusion. The same microvascular impairment can blunt the cortical oxygen rise during a mental arithmetic challenge. Beetroot-derived nitrate can partially restore vasodilatory capacity in some older adults by supplying an extra source of nitric oxide, thereby improving perfusion indicators in both skin and brain in controlled settings. Variability and interacting factors determine the magnitude and duration of those effects. Introduce dietary nitrates and conversion to nitric oxide. Dietary nitrates come mostly from vegetables. Leafy greens and root vegetables are common sources. Beetroot is a prominent example because it carries a high nitrate load in a compact form. Mechanism: eating nitrate-rich foods leads to intestinal absorption of nitrate into the bloodstream. Cause: the circulating nitrate becomes available to salivary glands and peripheral tissues. Effect: the body gains a substrate pool that can be converted downstream into bioactive nitrogen species. After absorption, much of the plasma nitrate is taken up by the salivary glands and concentrated in saliva. Mechanism: active transport into saliva creates an enterosalivary circulation. Cause: oral bacteria possessing nitrate reductase enzymes reduce nitrate to nitrite on the tongue and in the oral cavity. Effect: nitrite-rich saliva is swallowed, increasing nitrite exposure to the stomach and systemic circulation. In the acidic stomach, and later in blood and tissues, nitrite can be chemically and enzymatically reduced to nitric oxide and related species. Mechanism: low pH and reducing proteins such as deoxyhemoglobin, myoglobin, and enzymes like xanthine oxidoreductase catalyze nitrite conversion. Cause: these pathways become more active under low oxygen or acidic conditions, shifting nitrite into nitric oxide and nitrosothiols. Effect: Local generation of nitric oxide supports vasodilatory signaling and nitrosative modifications that can alter vascular tone and platelet activity. Beetroot illustrates this pathway in practice. Mechanism: beetroot juice delivers concentrated nitrate along with antioxidants such as betalains and polyphenol. Cause: these phytochemicals may help limit oxidative loss of nitrite and nitric oxide, preserving bioactivity as nitrite circulates. Effect: consumption of beetroot products raises plasma nitrate and nitrite levels, increasing the substrate available for tissue-level nitric oxide formation, particularly where oxygen is low. Oral ecology and stomach conditions influence the conversion efficiency. Mechanism: antibacterial mouthwash reduces oral nitrate-reducing bacteria. Cause: fewer bacteria means less conversion of nitrate to nitrite in saliva. Effect: systemic nitrite and subsequent nitric oxide formation are diminished. Similarly, elevated gastric pH can slow acid-driven nitrite to nitric oxide reactions and reduce local NO release. The nitrite-nitric oxide pathway operates independently of nitric oxide synthase enzymes. Mechanism: enzymatic and non-enzymatic reduction of nitrite provides an alternate NO source when NOS activity is limited. Cause: under hypoxic or acidic circumstances, nitrite reduction is favored and becomes a critical NO-generating route. Effect: this mechanism supplies nitric oxide where and when it is most needed for vasodilation and microvascular signaling. Use beetroot as functional example. Aging reduces capillary density and endothelial function in the brain. Mechanism: endothelial nitric oxide synthase activity declines and oxidative stress increases. Cause: this reduces nitric oxide availability at the microvascular level. Effect: less vasodilation and lower oxygen delivery to neural tissue. Beetroot contains high levels of inorganic nitrate. Mechanism: oral bacteria reduce nitrate to nitrite in the mouth, and nitrite is further reduced to nitric oxide in blood and tissues, especially under low oxygen conditions. Cause: consuming beetroot or beetroot juice raises circulating nitrite and can boost NO bioavailability. Effect: increased NO leads to vasodilation and reduced microvascular resistance. Nitric oxide acts on vascular smooth muscle through the cGMP signaling pathway. Mechanism: NO stimulates soluble guanylate cyclase, increasing cGMP and causing relaxation of arterioles and precapillary sphincters. Cause: this relaxation can recruit capillaries and improve flow distribution in microvascular networks. Effect: enhanced capillary perfusion increases oxygen extraction and can raise local brain tissue oxygenation. Older adults often have altered oral microbiomes and reduced saliva production. Mechanism: fewer nitrate-reducing bacteria and less salivary nitrate delivery limit nitrite formation. Cause: the enterosalivary conversion chain becomes less efficient with age or when antiseptic mouthwashes are used. Effect: the potential of beetroot nitrate to increase NO and improve microvascular perfusion is attenuated in these situations. Beetroot interventions have been tested in older populations using whole vegetables, concentrated juice, and powdered supplements. Mechanism: these preparations supply inorganic nitrate that follows the nitrate-nitrite NO pathway. Cause: trial participants commonly show rises in plasma nitrite and short-term vascular effects. Effect: some studies report improved peripheral and cerebral blood flow measures and modest functional benefits, though responses vary between individuals. Physiological variability affects outcomes. Mechanism: factors such as baseline endothelial function, kidney clearance of nitrate, oral bacterial composition, and concurrent medications influence nitrate metabolism. Cause: this variation changes how much NO becomes available after beetroot intake. Effect: real-world effects on brain oxygenation range from measurable improvement to minimal change depending on the person. Dietary context and preparation matter. Mechanism: whole beetroot provides fiber and other phytochemicals that interact with nitrate metabolism, while concentrated juices deliver a faster nitrate load. Cause: timing relative to meals and use of antibacterial oral products alter the enterosalivary cycle. Effect: Practical choices such as eating cooked beets, drinking beetroot juice, or avoiding antiseptic mouthwash around intake can influence the net impact on cerebral microcirculation. Beetroot offers a clear functional example of how dietary nitrate targets the NO pathway to influence microvascular tone. Mechanism: it supplements a non-enzymatic NO source that becomes especially relevant under hypoxic microenvironments common in aged tissue. Cause: this supplementation can help offset some age-related reductions in microvascular perfusion. Effect: the net result may be improved oxygen delivery to vulnerable brain regions in some older adults, though effects are individualized and not guaranteed. Address realistic cardiovascular limits. Aging reduces endothelial nitric oxide production and decreases capillary density in brain tissue. Endothelial dysfunction impairs vasodilatory signaling. The mechanism: less NO availability means reduced endothelium-dependent dilation in arterioles. That causes a lower ability to match blood flow to local metabolic demand. The effect is a narrower margin for maintaining oxygen delivery during stress. Cardiac output and arterial stiffness set hard limits on how much perfusion can increase. The mechanism: stiff large arteries alter pulse wave reflection and raise central systolic pressure while reducing the Wien-Kessel buffering that normally sustains capillary perfusion. This causes greater transmission of pulsatile energy to fragile microvessels and a reduced capacity for flow augmentation. The effect is that even potent vasodilators cannot fully restore microvascular oxygenation when pump function or vascular compliance are the bottleneck. Dietary nitrate from beetroot follows a distinct mechanistic pathway. Oral bacteria reduce nitrate to nitrite, and nitrite can be converted to nitric oxide in low oxygen or acidic environments. That causes vasodilation of resistance vessels and can raise plasma nitrite levels. The effect in older adults varies. Subjects with preserved cardiac reserve and intact microvascular reactivity may show measurable increases in regional perfusion, while those with heart failure, significant carotid disease, or autonomic failure often show little or no cerebral oxygenation gain. Medication and disease interactions present practical constraints. The mechanism: co-administered vasodilators or phosphodiesterase inhibitors amplify systemic vasodilation or alter NO signaling. That causes potential drops in systemic blood pressure and altered cerebral perfusion pressure. The effect is a safety and efficacy limit. Dietary nitrate is not uniformly additive to other therapies and may be contraindicated in specific pharmacologic contexts. Physiologic reserve and regional pathology matter more than single biochemical changes. The mechanism: microvascular dilation requires both a pressure gradient and distributive capacity downstream. When cardiac output is fixed or carotid inflow is restricted, vasodilation redistributes a finite blood supply rather than increasing total delivery. That causes situations where beetroot-derived NO widens vessels, but fails to increase tissue oxygen tension. The effect in practice is modest and context-dependent improvements, not universal restoration of oxygenation. Realistic expectations depend on baseline cardiovascular status. The mechanism: preserved autoregulation and flexible large artery compliance allow a nitrite-driven increase in flow to reach capillaries. Conversely, in advanced systolic dysfunction or severe atherosclerotic narrowing, the cause is limited inflow or pumping ability. The effect is predictable. Interventions that target only NO signaling have a ceiling defined by these upstream cardiovascular limits. Vascular efficiency impacts clarity and energy. Aging alters the small vessels that feed the brain. Mechanism: endothelial cells normally produce nitric oxide to relax arterioles and maintain capillary flow. Cause: with advancing age there is lower nitric oxide bioavailability and structural changes in capillaries. Effect: regional oxygen delivery becomes less consistent, and mental clarity and sustained energy decline. Mechanism: microvascular rarefaction and parasite dysfunction reduce the capillary surface available for oxygen exchange. Cause: chronic low-grade inflammation and oxidative stress blunt angiogenic signaling and impair endothelial responses. Effect: Oxygen extraction during cognitive work falls, which can slow processing speed and raise the sense of effort for routine tasks. Mechanism: dietary nitrate follows an enterosalivary conversion to nitrite and then to nitric oxide, supporting vasodilation. Cause: consuming nitrate-rich foods such as beetroot increases circulating nitrite when the oral microbiome converts nitrate on the tongue. Effect: some trials show improved endothelial-dependent vasodilation and modest increases in cerebral perfusion during tasks, which can transiently support attention and brain energy metabolism. Practical examples include acute beetroot juice raising plasma nitrite and lowering peripheral blood pressure in clinical studies, and task-related imaging showing localized perfusion changes after nitrate intake in older adults. Mechanism: the interaction between vascular efficiency and neural demand sets cognitive output. Cause: when microcirculatory delivery fails to match neuronal oxygen needs, networks that support clarity and sustained attention operate less efficiently. Effect: the result is reduced mental clarity and lower perceived energy during prolonged cognitive work. Individual response varies. Factors such as oral bacteria, baseline vascular health, and concurrent medications influence how much nitrate from beetroot will alter nitric oxide signaling. Aging reduces endothelial function and capillary density. Less nitric oxide is produced, brain oxygen delivery can decline. Reduced microcirculatory flow lowers oxygen extraction. Neurons receive less oxygen during demand. Cellular metabolism may slow. Beetroot provides dietary nitrate. Nitrate converts to nitrite and then nitric oxide via established pathways. NO increases vasodilation and can improve microvascular perfusion. In short, aging impairs microcirculation. Nitric oxide supports vasodilation. Dietary nitrate serves as a useful case study. If you are over 60 or care for someone who is, these mechanisms may be relevant to understanding changes in brain oxygenation. This is a scientific overview, not personal medical advice. Consult a healthcare professional for individual guidance. If you found this helpful, like and subscribe for concise, evidence-based updates. Ask questions in the comments. Next, we will cover how exercise, sleep, and common medications influence microcirculation. Thanks for watching.